Let's start with what the most people outside the industry think about first, USPH inspections. Captain Thomas, I know you had decades of experience with this. Would you say these inspections are the gold standard?
Well, you know, Dimitru, the U.S. Public Health Service vessel sanitation program has been very successful over the past 40 years for several reasons. Number one, it's a cooperative program with the cruise industry. The VSP operations manual, covering 8 key public health areas of concern on cruise ships, was developed cooperatively with input from Cruise Line International Association, that's CLIA, the cruise lines, and the shipyards that build the cruise ships. These are some of the highest standards based on model codes and best practices in the world. And number two, the periodic unannounced inspections performed by the VSP are actually paid for by the cruise lines. It's a fee-for-service inspection program, and the cruise ship being inspected is presented with an invoice at the end of the inspection. Number three, the inspection reports themselves are actually published on the VSP website so that the public can read them. Additionally, there is a score given in which points are deducted based on the associated risk with each violation of the operations manual observed and documented in the inspection report. There are 4 and 5 point violations that are considered high risk, followed by the 3, 2, and 1 point lower risk violations. Also, officers conducting the inspection have the discretion of giving an asterisk, and no points are deducted when there are extenuating circumstances that warrant it. And 86 is the lowest passing score. 85 or below requires a reinspection. And lastly, number 4, something I really like, the cruise line must submit a corrective action statement as to how they will address and correct each violation, including any asterisk items. If that asterisk observation shows up again on the next inspection, more than likely points will be debited. But, you know, I have to say, despite the success of the VSP, the increased compliance with the operations manual requirements, and the corresponding improved scores over the years, the true success of a quality public health program that is preventing illness and injury and responding to outbreaks and emergencies, it really comes down to the day-to-day operations on board, both officers and crew embracing the standards of public health. The cruise lines, the VSP, and the traveling public have come to expect. That's the gold standard.
That's such a clear and insightful breakdown, Captain Thomas. And I think it underscores something important. The VSP isn't just about inspection to catch mistakes or getting a good score. It's more about an industry that wants to promote high standards for public health at sea. But here is one big question for me. When we look at operations manual in practice, how well do cruise ships live by that document?
That's a good question. The operations manual, all 300 and 50 pages of it is as comprehensive as it gets. But implementation, as I said before, that is embracing the high standards of public health and creating a positive public health culture are the keys to success. You can have a top-notch manual on the shelf, but it doesn't mean much if, for example, the risk factors that cause food or waterborne illness are not addressed and there is a lack of active managerial control on board.
Exactly, Captain Thomas. I performed audits where raw animal products were stored above ready-to-eat items. That's a textbook case of cross-contamination. That's a 3-point violation under the section 7.3.3.2. It's classified as a high-risk issue. I've also seen time control plans missing or incorrectly implemented at self-service buffet. That's another critical 5 points deduction under section 7.3.5.3.5, since food held in the temperature danger zone pose a real risk of outbreak. And in some venues, there was no proper consumer advisory posted, where raw or undercooked items like sushi or rare steaks, ex-cooked to order, were served. That's a 5-point violation under section 7.3.6.1.2. This may seem like simple oversight, but under VSP scoring, they signal potential for real harm and significant impact to the ship public health grade.
Yes, and sometimes it's not about a lack of caring, but a lack of knowledge and or understanding. Take water management, for example. Section 5.4 talks about backflow prevention, but if the team doesn't understand how a vacuum breaker works or why it even matters, you have a lack of training. Fundamentally speaking, as laid out in the operations manual, knowledge plus performance of duties equals active managerial control. That brings us back to the gold standard we've been talking about.
Let's dig into that, Captain Thomas. One non-conformity I still see often, it's around water distribution system, backflow prevention devices, inspection and testing. That's straight out of section 5.7.2. It's basic, but it tells us whether the water is potable or technical, and mixing those up can have a serious consequences.
Yes, and let me say this to all our listeners in senior leadership. The operations manual is your blueprint, but your teams are the builders. If the blueprint isn't followed by the builders, if the requirements aren't taught, tested, and supported with some systems and accountability, then all we're doing is setting the stage for failure. And remember, officers and crew must truly embrace this culture.
Well said, Captain Thomas. And if you are in training or management role, I encourage you, walk your ship with a manual in hand, not just to check off boxes, but to ask questions like, do we understand this? Does this make sense operational? And what would you do if the system failed at sea? And as you know, operations manual doesn't always give the underlying why to the requirements. That's where we, as GPHS trainer, play an important vital role in providing the knowledge and the understanding needed of the VSP requirements.
Exactly, because when the VSP inspectors come on board, they're not just looking for violations of the operation manual. They're looking for evidence of a positive public health culture. They want to be assured that officers and crew are addressing the risk factors that cause outbreaks, and they have active managerial control over their operations. Back to the gold standard. And that, in the end, is what truly protects our guests and crew.